Even though any tumor that develops in the ovary is technically ovarian cancer, there are many different versions of ovarian cancer. In this video, I'll discuss why these tumors behave differently and why they are classified differently. So let's get started. So if you look at the ovary, it has three different types of cells. There are cells which are on the surface of the ovary. These surface cells are called the epithelial cells. In addition to the surface cells, inside the ovary is where we have what are called the germ cells. These germ cells are where eggs are located. And then, as you can imagine, in between all of this is this layer of cells we call stromal cells, which is holding the structure of the ovary together. So these are stromal cells. Which type of ovarian cancer are we talking and what the prognosis is depends on where the cancer is originating from. The most common type of ovarian cancer develops from epithelial cells, and the most lethal and deadly of these is the high-grade serous ovarian cancer. Sometimes we use the acronym listed here, but this is high-grade serous ovarian cancer. There is a less common version of serous epithelial ovarian carcinoma, and that's called the low-grade serous ovarian carcinoma. Low-grade serous carcinomas are generally not treated surgically. They affect younger women, but overall the prognosis is better than high-grade serous carcinoma unless the low-grade serous carcinoma is found in an advanced stage which compromises the bowel integrity or the disease is very spread out. But by and large, statistically speaking, if you were to look at 100 women diagnosed with low-grade serous carcinoma and 100 women diagnosed with high-grade serous carcinoma, you'll find at an average women with low-grade serous carcinoma live longer. These are the two most common, but then there are other epithelial ovarian carcinomas. Some of them can be even more aggressive than high-grade serous carcinoma. One of them is called the carcinosarcoma. Another one is clear cell. The clear cell carcinoma has an association with patients who have endometriosis. There are some other rarer types of ovarian epithelial carcinomas, like the endometrioid type. Endometrioid also has an association with endometriosis. Here the glands of the ovarian cancer look like the inside lining of the uterus, but these are the most common epithelial carcinomas. By and large, these tumors, other than the exception of low-grade serous carcinoma, respond well to chemotherapy and most often are treated with a combination of two drugs called carboplatin and paclitaxel. More about chemotherapy in some of the chemotherapy videos you will see in this playlist. Let's move on to the germ cell tumors. The germ cell tumors often affect younger patients, and they have an excellent prognosis. Some of them are dysgerminomas, a yolk sac tumor, choriocarcinoma, and there are some fewer rarer types of tumors as well. But by and large, these tumors are very responsive to chemotherapy. Even in advanced stages, they are curable. Unfortunately, they affect younger women. It can happen at any age, but they're mostly treatable with the combination of surgery and chemotherapy. And because they respond to chemotherapy so well, cure rates are very high in these tumors. And finally, the tumors that develop from the stromal cells, the two most common are granulosa cell and Sertoli Leydig. These are rare, but granulosa cell tumors are fairly common. They are treated with chemotherapy, but the response rate is way less than any other tumor. But they do respond to anti-hormone therapy, especially hormone blockers that block estrogen, such as letrozole, which is one of the most common treatment, also called as AIs, aromatase inhibitors. There's a few of them on the market, and more about that in the chemotherapy video in this playlist. But this overview will help you understand that when you see patients in a support group or you meet someone with ovarian cancer, they may or may not have the same type of ovarian cancer as you have, and their prognosis might be very different. So this is important information to know, and sometimes we get asked that patients know someone with ovarian cancer who's lived many, many years, it could certainly be somebody with a high-grade cancer, but were fortunate that their tumor responded to treatment, or they were in a clinical trial where the treatment was very effective for their particular type of tumor. Or they could be somebody with a yolk sac tumor or a dysgerminoma, which is a germ cell tumor, and they responded very well to treatment as expected. Or they could be somebody with granulosa cell tumor where treatments go on for years and multiple surgeries are sometimes involved in removing the cancer. I hope this helps people understand the different types of ovarian cancers.